All right. Okay. Oh wait, we got to do room scan. So hello, my name is Wayne, nurse anesthesia resident. I want to just do a little room scan. This is my assessment here, head to toe soap note that I'll be creating, and this is the assessment part. A little bit of tools of the trade right there. Just a Snell and I chart, hand sanitizer, modified reflux hammer, no sheet material. All right, let's take a look here. Okay, and I'll be getting my test. First thing I'm going to do, come in, wash my hands, most important, before I touch the patient. Hello, sir. Good afternoon. My name is Wayne. I'll be your nurse anesthesia resident. I'm just going to be doing a head-to-toe assessment. First thing I'm going to do is I'm going to do a general survey. I'm going to take a look at my patient. I note the patient has overall appearance is clean, well kept. Doesn't look like appear to be in any acute distress. Just kind of once over. I'm going to take a look at the integumentary. Looks appropriate for ethnicity. I'm looking for cyanosis or jaundice or any obvious signs of sores or swelling, heaves or difficulty breathing. Everything so far looks okay. I'll go ahead and move on with my exam. I'm just going to click some vital signs. It looks like the medical assistant got your pulse ox. I'll be getting your temperature. We're going to do a temp panic. Temperature here. You can do it many other ways. Excellent. 97.9. Perfect. Next thing I'll be checking your blood pressure. I'm going to do a manual blood pressure, demonstrate the cough sounds. I want to make sure I'm going to note which side I'm going to be placing the blood pressure cuff on, his right side. I'm going to note his positioning. He is sitting. I'm also going to ensure that the cuff fits properly, which it does. Listening to some cough sounds while I'm doing this. I'm going to inflate to approximately 180. Hopefully I will stop hearing the sounds. Go down until I hear cough sounds. And then I will continue deflating the cuff until I do not hear them, and that will be my diastolic. So, deflating. Where the fuck did he get this? We're just going to slowly deflate. I hear nothing at 180.
Well, your animal test wasn't wrong. I'm guessing you're about 7 meters.
Hearing sounds at about 135. Starting to go away. And at about 79, I stopped hearing. 70. Wonderful. Next thing I'd like to go over is this MMSE, which is the only piece that I have here. Nothing else. No other source of materials. So what, Mr. RD, what year is it?
It's 2025.
Excellent. And what season?
It's fall, heading into winter.
Excellent. And what date of the month and what month?
It is November 18th.
Good job.
Thursday.
Okay, and where are we now? What state, county, town?
We are in Oregon, in Albany, in Lynn County.
Good. And I'm going to name 3 objects very slowly, and then I'm going to ask you to name all 3 of them in just a minute, okay? So we're going to go with cat, square, and bottle. Cat, square, and bottle. I'd like you to spell the word world, but backwards.
D-L-O-R... Wait, D-L-O-R-W? No.
One last chance. World.
D-L-O-R-O-W.
R-O-W. Good job. Okay. Earlier I told you to name 3 things. Can you tell me what those are?
Cat, square, bottle.
Good. I would like to show you a couple objects and have you name them. What is this?
Thermometer.
Good. And what is this?
Pin.
Excellent. I want you to repeat the phrase, no ifs, ands, or buts.
No ifs, ands, or buts.
Okay, excellent. Piece of blank paper, okay. I would like you to draw this just right next to it, just how it is there. I'm getting a blank piece of paper here for this next one. Nice, excellent, perfect. Now I'd like you to take this piece of paper with your right hand. I want you to fold it in half and then put it on the floor. Excellent, wonderful. I would like you to read this top line here. What is the top line there?
D&B Bear Service.
Okay, perfect. Excellent. You got a 30 out of 30 on your MMSE. As you have an appropriate mental status, I'll be placing this over here. Okay, we continue on with our exam. I'm just going to start with your hair, face, and then work my way down, okay? So stop me if I have any problems. I'm going to go ahead and look at his hairline, looking for any sores, any obvious signs of infestations like lice or anything like that. It all looks pretty good there. Kind of generally look at his face. So what I'm going to do is I'm going to shine a light in your eyes. I'm going to look for light reflex. Just go ahead and stare over here at me. Shine a light. Pupils are equal, round, and reactive. Wonderful. I now here have a Snellen eye chart. This is a miniature one. He only holds it 14 inches from his face, and I'd like you to start at the top line and read the first 3 lines, please.
95874.
Okay. Now read this line here.
8745.
Good. Now I'd like you to read this bottom line there. Can you read the most bottom one?
42573.
Nice. Actually, good. Yeah, good. Good. 20 vision was like, for vision from 20 feet away, the modified Snellen chart, you can do it from 14 inches. So, next thing I'm going to have, go ahead and look at me. Go ahead and smile. Open your mouth. Stick out your tongue. Move from side to side. We're checking that hypoglossal motor tongue. Go and open your mouth. I'm going to say, ah. I'm looking at his tonsils. Looks like he's got a little bit. Good. Palate looks bilateral. Tonsils look unremarkable. Are you able to raise your eyebrows? We're looking for, this is all more facial nerve. Are you able to close your eyes real tight? Excellent. Look at me now. I'd like you to let me know when you see my fingers come into your visual field. Okay. What about over here? Can you see them here? Still see them? Okay. What about over here?
Yeah.
Okay. Excellent. I'm going to go ahead and look in your nose here. I'm looking for deviations. Wonderful. Everything looks easy and even. Can you puff out your cheeks? All right, excellent. This is checking more of the facial sensory motor. I'm going to go ahead and look in your ears. I'm going to look around your ears for any nodes, behind auricular for any nodes or swelling. I don't see them. Going up on the trace. If I had an otoscope, I would look inside, looking at the tympanic membrane. I do this to both sides. Excellent. Still see. I'm going to feel down here at the jaw for TMJ. Are you able to open your mouth? Good. I don't hear any clicks side to side. Excellent. I don't feel any clicks or any grinding, any pain associated with that. No. Okay. If I had an otoscope, I would look inside his eye to examine his optic disc and make sure that all the structures in the anatomy are appropriate there, which I do not have. Let's see. I'm going to go ahead and test. I have a little alcohol pad here. Want you to close your eyes. I see. You feel that light touch here on your face?
Yes.
Okay. What about over here?
Yes.
Okay. You feel it up here?
Yeah.
Good. He's got appropriate facial nerve sensation. Let's see here. Just continue to look. If I didn't say before, his skin's appropriate for ethnicity. I don't see any bronzing or cyanosis, anything like that, or any obvious signs of infection. His skin feels Feels warm and dry. It's not cool or clear, not diaphoretic. I'm going to check above the clavicle line for skin turgor. I'm just going to go ahead and start feeling his. I'm going to start feeling his lymph nodes and his hypoglossal or submandibular lymph nodes. No swelling. Down into the neck area, behind the ears, cervical lymph nodes in the back. Nothing so far. All looking for any swelling or obvious signs of pain. None so far. I'm going to step behind here. I'm just going to go ahead and feel the back of his neck, where his thyroid is. I'm going to try to push it to one side and feel it does not feel enlarged or swollen. Any pain associated with that?
No.
Do it with the other side. Excellent, excellent. Okay. Are you in any pain currently?
Little abdominal pain here.
Okay. When did it start?
A week ago.
Okay. How would you rate the pain? 0 being none, 10 being the worst you can imagine. What number?
Like a 1.
Okay. Does anything make it better?
Maybe just laying down a little
Okay. Does anything make it worse?
bit. No.
No? Okay. All right, I'll next be moving on. I'm going to check spinal nerve 12. Go ahead and bring your shoulders up. Excellent. He's very strong. Can you bring your neck side to side? I'm just going to check cervical range of motion. Can you look up and down? Again, just checking neck range of motion. Can you shake your head now, left and right? Good, good, good. All right, I'm going to check. I'm going to go ahead and have you look at this curtain here, and then I want you to look back at me. Good. Now back at the curtain, back at me. Any disconjugation there? No blurriness or double vision. Okay, excellent. Now I'm going to have you go ahead and touch your nose and touch my finger. This is checking his 6 cardinal positions of gaze. One more time. Good job. Okay. All right, I'm going to be moving on here. First, I'm just going to take a look and observe his breathing. Looking for any heaves or problems and obvious difficulty. I'm going to go ahead and feel for any tactile fremitus. Do not feel that? Yep, just breathe normally. Excellent, excellent. I'm going to go ahead and listen. Before I do that, I'm going to look from the side, check his ratio, noting for any barrel chest. His ratio looks to be from front to back. It does not look to be any signs of problems there. Okay, I'm going to go ahead and listen with the diaphragm in a ladder pattern. Go and take a deep breath. And breathe out. I'm listening for any adventitious breath sounds, strider, rails, crackles. Another deep breath. Good. Deep breath. Good. Checking all lobes and quadrants. Deep breath. Good. Deep breath. Lung sounds are clear. Check back as well. Actually, I'll step back there. Again, checking all quadrants, listening for adventitious breath sound. Deep breath. Good. Another deep breath. Again, in this ladder pattern. Good. A few more. Good. Good. And last one. Excellent. While I'm back here, I'm just going to go ahead and feel under the 12th rib here. And feel. Let me know if this hurts. I'm going to check for costovertebral angle for any tenderness. Hurt at all?
No.
Okay. Any problems there?
No, just
On the front? Okay. Nothing in the back, though. Okay. No. He's negative for any costovertebral ankle tenderness. Wonderful, wonderful. Now I'm going to listen to heart sounds. I'll be checking on the second intercostal line for the along the right midclavicular for the pulmonic valve or aortic valve. All right, listening at the diaphragm. I'm listening for murmurs, regurgitation, diastolic or systolic murmurs. Sounds normal, no clicks. I'm listening over here on the left side of the pulmonic valve. Excellent. Then I'm going to go feel myself go down here, midpoint here, at Herb's point. Excellent. Fifth intercostal. And I'm going to move down and feel the apex of the heart as well. I'm listening at the mitral valve, listen for any murmurs or regurgitation. I'll listen for 1 minute and take an accurate heart rate. Wonderful. While I'm here, I'm going to listen with the bell. I'm just going to feel first. I'm going to feel for any thrills over his carotid arteries. Do not feel any obvious whooshing or thrills palpable. And I'm going to listen for any bruise.
Never better.
Hold your breath. Hear nothing, you take a breath. I'll listen to the other side. Hold your breath for just a second. I hear no bruise or blood carotid. Next thing I will be doing is I'm going to go ahead and have you lay down. We're going to do an abdominal assessment here. Let me get you a pillow. Wonderful. First thing I'm going to do is just take a look at the abdomen. I'm going to contour, shape. No history of surgeries or anything like that. I'm making sure I'm not pressing on anything that might be painful or otherwise tender. I'll note that there is some right upper quadrant tenderness, so I'll be a little bit more careful there, but I will feel. So the first thing I'm going to do is listen. All four with the diaphragm, starting with the upper right quadrant, listening for vowel sounds.
You don't look at me the same way again, will you?
In this case, his vowel sounds are normal active. Upper right quadrant. Let's listen to the lower right quadrant. Positive normal active vowel sounds. Left upper quadrant. And left lower quadrant.
Take a walk.
Good. Now while I'm here, I'm going to go and listen with the bell of my stethoscope for any abdominal bruise, the abdominal aorta. Each size for any renal bruise. I hear none. Excellent. I'm going to do some light palpations for next, and then after that, I'll do some deep palpations. Is that okay? Okay. Doing light palpations. No rebound tenderness there. Is it a little bit tender? Okay. All right. Just again, light, looking for rebound tenderness, guarding. Now I'm going to do some deep palpation over the right upper quadrant, feeling the liver. It doesn't feel obviously enlarged. Any pain there? Just a little pain. Okay. Over here, the McBurney's point. No tenderness there. On the left, a more spleen area. No splenomegaly. Again, looking for any guarding or rebound tenderness in left lower quadrant. No about issues. Okay. Any problems there? Okay. Abdominal assessment is normal. Go ahead and sit up here. All right. All right. We're going to go on to do some musculoskeletal things, but I'm going to check the olfactory nerve. This is our therapy cat. She's very fluffy. You close your eyes, and I'm going to test the smell with 2 scents. Here, we'll just use this one. All right. What's this smell?
Peppermint.
Yep, peppermint. You got it. Good job. Next one?
Wintergreen.
Yeah, wintergreen. You got it. All right, so we checked the olfactory nerve. And then I'm going to go ahead and have you just stand up here. We're going to check, step back there, and I want you to do the heel to toe walk. Yep, just like that. Yep. Excellent. I'm looking for any imbalance issues. We're checking the cerebellar. There's no motion or imbalance. His gait was steady. Go ahead and sit back down there. Next thing I'm gonna do is I'm just gonna go around. I'm gonna check all your pulses. I'm gonna do a peripheral vascular check. Let's look at your hands here. I'm looking for any clubbing over the fingers. I'm gonna check for capillary refill. Capillary refill looks like about 2 seconds, very brisk. And again, colors pink and doesn't look looks like normal shape. I'm gonna go and check some pulses here. I'm gonna start with this radial pulse. Both sides.
What's going on?
I would rate these as 2+.
He's coordinating now with the law enforcement.
Check brachial pulse here.
I'm almost there.
Good. Good strong brachial pulse. Check it on the other side as well. It's not as easy to feel as I would have thought.
I'm home now. I'm safe. I promise.
Okay. Excellent. Excellent. Next, 2+, both on the brachials. Next, I'm going to check his posterior tibial pulse behind, in the medial part of his, behind his heel.
Hi, exactly. Can you call back?
It's a good posterior tibial pulse on the right. Check it out on the left as well. I would rate the first one as 2+. This one here, a little trickier to find, but I got it. That as well, 2+ on the posterior tibial on the both right and left side. I'll be checking on the pedal pulse on the dorsal parts of his feet. Just proximal to the great toes. They're both equal, strong, 2+. Excellent. Next thing I'll be doing is I'll be checking some tendon reflexes. First one is I'm going to have you go up here. I'm going to check out the triceps and go and just relax. Excellent. Got a 1+, 1 to 2+. Good, 2+ there. I'm going to check on your wrists here. Good. Good, again, 2+. I'm going to now check your reflexes on the popliteals here. Go ahead and just let them hang and relax. Wonderful, wonderful. Good. 2, 3+. I'm looking for things like hyperreflexia or hypo. Good, excellent. Get on the next to the Achilles. Good. All right, those would all be 2. I would rate them all at 2+. Next thing I'm gonna do some range of motion tests and some strength tests. Go ahead and squeeze my fingers. Tight. Good. Got 5 out of 5. Strong reflexes. Go ahead and pull towards you. Good. Push. Excellent. Are you able to raise your hands up like this and down? Any pain with that? Excellent. Are you able to flex your arms? Any pain associated with that? Looks like full range of motion in the shoulders, full range of motion at the elbows. Are able to open your fingers up and close them. Good. He's got full abduction of the fingers. Wrists. Are you able to flex your wrists? Any pain? I'm looking for things like paresthesia, numbness going down your fingertips, or loss of sensation. Any problems with that? No. Okay. Excellent. Let's go and have you. I'm gonna have you lay back down. I'm going to do a few musculoskeletal tests. I'm going to do a drawer test to check for front and back ligaments. So I'm going to hold the leg in place and I'm going to push. Any pain when I push there? I'm looking for basically the tibia fibula to slide front and back, and making sure I'm putting stress on the anterior and posterior cruciate ligaments. And any pain associated with any of that? Good. Excellent. So that would be a normal finding. Same thing here. We're going to push and pull. Any pain with that? Okay. Same with that. I'm assessing the ligaments there. No pain. Now I'm going to do a valgus and vargus test. Have you rotate this in. Any pain there? That's checking more lateral collateral, or medial and lateral collateral ligaments. Everting in and coming out. Valgus, vargus. Same thing. I'm going in and out. Any pain associated with that? Excellent. Last thing, we'll go ahead and have you. Actually, we can do this. I want you to push against my foot or my hand. I'm having him push down like a gas pedal. Now pull. That's the plantar and dorsiflexion. They are both strong. Good. Now push down the gas pedal. Excellent, excellent. No pain associated with any of that. All right, I'm going to go ahead and have you bring your hips up. Any pain in the hip there? I'm checking hip range of motion. It looks normal and no crunches or nothing's catching or anything there. I'm also feeling his knee as he does that. Knee range of motion seems smooth and easy. I'm going to check the left hip. I'm looking for any impediments or hip dysplasia or any signs of catching. None of that. Also on your knee felt smooth as well. Go ahead and have you stand up here. Wonderful, wonderful. Let's see. Any questions for me so far? Okay, we've checked muscle strengths and range of motions. I would, for this exam, I would be foregoing any genitalia tests or anything like that. We went over patient history. We went over medications previously before the exam. Just trying to think if there's anything else I need to check. Nothing's coming to mind so far. I believe I got it all. Cranial nerves. Okay, well, thank you so much. We'll get the results in your lab tests ordered, and we'll follow up later. Okay, thank you.
Yep.
I don't think I forgot anything. I probably did. 26 minutes.